Good afternoon and welcome to our Lunch and Learn session. Today talking about safety in the workplace and infection prevention. The Chamber is proud to present these Lunch and Learn webinars to inform our members and also to create conversations around important issues like this one. I'm Scott McCammon, President and CEO of the Milton Chamber, and we're also going to be airing this show on Cogeco Your TV. So welcome to all of the viewers on Your TV as well. So following the presentation, we will have an open Q&A, so you can put your questions into the chat room, and I will be moderating, so I'll read out the questions. Or if you want to ask a question live, you can raise your Zoom hand, and I will get to you. So as we know, COVID-19 has brought infectious disease into the spotlight and really has put pressure on all businesses to adapt, and that's going to continue as we move into post-pandemic operations. Today, we're fortunate to have Doug Sooley, owner of Sooley Safety Services, and Debbie Duclos, owner of Shaping Minds in Healthcare, with us today to review everything from the importance of safety programs that include infectious disease controls to the benefits of tailored infection control and prevention programs for the workplace. By way of introduction, Doug Sooley launched his company in 2015 to offer health and safety training and consulting services to small and medium businesses. Since he graduated from Brock University in 2007, Doug has worked in workplace safety capacity in lumber, transportation, construction, and warehouse and logistics industries. And for almost 3 decades, Debbie has experienced a progression of positions in home care, acute and long-term care markets, medical device sales, specialty pharmaceutical, clinician training roles, and also public health. And as the founder and CEO of Shaping Minds in Healthcare, she's been a consultant in the medical device industry in Canada and successfully launched the company's subscription-based ambassador program in infection control and prevention. Her leadership has driven vital improvements in public and private healthcare, successfully integrated medical device training solutions across Canada, and strengthened businesses in infection control and prevention best practices. So Debbie and Doug, thank you and welcome.
Thank you. Glad to be
Doug,
here.
Thank you. So we've got your slides up on the screen, and I think, Doug, you're going to start and then turn it over to Debbie, and then we'll follow up with Q&A after that.
Yep. Thanks, Scott. Good morning, everyone, or I guess good afternoon. My name is Doug Sooley. I am the lead consultant with Sooley Safety Services based in Mississauga. We are a health and safety consulting firm that works with small to medium-sized businesses to help them navigate the health and safety laws. And as we all know, over the last few, basically 18, 20 months with COVID-19, health and safety has really come to the forefront for making sure that workers are protected. So today, we're going to go over a few different things here. I'm going to kind of take on the liability side for businesses, including specific laws and Health and Safety Act requirements. Debbie will then follow up with the respiratory disease spread liability for businesses, training and compliance in regards to the Health and Safety Act, and quality assurance standard of a standardized program. The goal of today is really to help you kind of understand what infection control is and how it's going to become more and more mainstream in regards to all types of businesses out there. So, Debbie. So we have a few questions that we want you to kind of keep in mind as we're going through the presentation. So the first one is, if a worker gets sick while working under your employ, can you be held liable if that worker becomes extremely ill and requires significant time off? Another one would be, if a customer walks into your business and catches an illness that causes them to take significant time off work, are you liable if it's traced back to your store? If you provide basic health and safety information and posters in the workplace, is there a need to train and retrain the staff on infection control measures in the workplace? And finally, if you have a written health and safety plan, is it recommended to consult with a qualified team to ensure it's following the guidelines and procedures to prevent the spread of disease? So these questions, we want to make sure that you have a chance to kind of really think about them as we're going through the presentation, and then we'll circle back to these as well as answer any further questions you may have at the end of the presentation here. So I wanted to just take a quick second here just to kind of summarize what the Health and Safety Act is. So the Health and Safety Act is a set of laws that details the duties and responsibilities of all workplace parties. Under the Health and Safety Act, employers, supervisors, and workers all have responsibilities to maintain health and safety. The employer, having the most authority and planning and controlling the work, has the most responsibility for health and safety of their employees. And the whole point of the Health and Safety Act is to make sure that workers can return home at the end of each day safely and sound. There's also regulations that are a little more detailed in regards to specific situations and circumstances. So a couple of examples with regards to infection control include the Reopening Ontario Act, which is the current act that details the requirements for COVID-19 response and prevention in the workplace. And Regulation 833, which is your control of exposure to biological and chemical agents. So this regulation has specific guidelines on maximum exposure levels to all types of chemicals that you may come into contact with in the workplace. The underlying philosophy for health and safety legislation in all Canadian jurisdictions is what's called the Internal Responsibility System, or IRS. All workplace parties are responsible for health and safety, as I previously mentioned. The Internal Responsibility System establishes responsibility sharing, promotes a safety culture, promotes best practices, helps develop workplace self-reliance, and ensures compliance. So with this system, the idea is everybody works together to help maintain health and safety in the workplace. It is the fundamental point in regards to maintaining health and safety. Everybody from the employer all the way down to the low-level worker will need to have responsibilities and need to help prevent accidents and illnesses in the workplace. An employer, as I mentioned previously, the employer has the most responsibilities. This is because the employer ultimately controls the work. They ultimately have final say in regards to the layout of the workplace and how that work is performed. So because of that, they do have their most responsibility. Employers are required to conduct regular risk assessments and establish control measures for any of the concerns that are found. They need to provide specific information and instruction about how to stay safe on the job. They need to make sure that measures and procedures identified are carried out in the workplace, ensure any equipment, materials, and protective devices are provided and maintained in good condition, as well as make sure that they're used properly or as prescribed by a regulation. They need to integrate safe behavior into the day-to-day operations, including corrective actions, and they need to take every precaution reasonable in the circumstance to protect a worker. So we'll get into that in the next slide with due diligence and how that is handled in the workplace. So as I mentioned, the employer needs to take all reasonable precautions under the circumstance to prevent illness or injuries in the workplace. So this is actually listed directly in the Health and Safety Act in Section 25, subsection 2H, which is the employer responsibilities. Due diligence is demonstrated by your actions before the event occurs, not after. Employers need to make sure that they take steps before an accident or illness occurs in the workplace. They need to implement an effective health and safety program, identify workplace hazards, implement controls to prevent illnesses and injuries, and train workers on the health and safety program and hazard control measures. So it's really important to understand as an employer that ultimately your only defense if there is a health and safety violation, or if there is an injury in the workplace, or if there is an illness or significant concern, is that you've done everything reasonable under the circumstance to protect that worker. So right now, with COVID, one of the changes that has come up is that the workplace and the employer is required to make sure that the workers are protected from COVID-19. So what they're using is Health Canada it's public health guidelines in regards to screening, physical distancing, the use of masks and other PPE, sanitizer. And what they've decided is that the ministry is using this as an enforcement to state that employers and businesses must implement these measures in order to help protect their workers from being exposed to COVID-19. So if a worker in this example potentially becomes sick, and it was found that the employer has not done what is required to be able to help protect that worker, then the employer can actually be found liable, and the health and safety laws will be used towards potentially charges or significant fines that an employer may face. Right now, the most recent one I can think of was a long-term care home, and I believe it was in London, that has been charged with failing to comply with the COVID-19 requirements, where there have been workers as well as residents who have been significantly ill or even have died as a result of the negligence, and they're currently going through the courts at this point. So it's important to make sure that you will need to make sure you take health and safety into consideration with all aspects of your business. But as we are dealing with infection control here, infection control is something that's going to remain in play long after COVID has been at least handled and managed. So just with a reminder, some of the things you can do to help increase the due diligence in the workplace, including creating your health and safety policy and policies and forms to support that policy. You need to identify, assess, and control the hazards, whether it is regular workplace hazards such as equipment, slip, trips, and falls, or even with regards to infection control. You need to look at COVID measures, as well as some of the other more common viruses and illnesses that might arise. You do need to take these into consideration as well. Holding regular training and safety talks, making sure that you report and investigate any accidents that may occur in the workplace, conducting regular inspections to check on the requirements and whether they are being followed, and continuous monitoring and improvement, including doing regular reviews as well as an annual review of your entire program. The important thing is, if you set up a program, you do need to monitor and you need to make sure that you're actually following the program. You can't just have a manual that says that you need to do this and then not actually follow through with it. So, and I think from this point here, I'm going to pass it on to Debbie, and Debbie's going to take you through how infection prevention and control works with regards to the workplace and in general. Take it away, Debbie.
Thanks, Doug. So thank you, everybody. I'm delighted to be here and share this on a continuation of the presentation. In particular, in infection prevention and control, COVID-19 has provided some valuable lessons on infectious diseases and their method of transmission, viruses and common illnesses. The current situation requires employers to protect workers, and Doug talked about the due diligence that's required there, and those requirements to protect the workers from these diseases will not change after COVID. So we're really focused from a prevention perspective, being proactive versus reactive, which helps to protect the workers, and it avoids potential shutdowns of workplaces. And so from that perspective, what should you do? You want to ensure that your COVID-19 measures are implemented and maintained within your workplace. And we're also looking to protect against future pandemics, and make sure that your safety plan and your pandemic plan are very integrated for business continuity. And as well, we want to make sure that you have consideration to common and some not so common viruses and other infectious diseases. So in this aspect, we talk about universal precautions from, for example, bloodborne pathogens and so forth. And you do need to, and it is recommended to train and refresh workers in this infection control program regularly. So when I talk about, let's go on to the next slide here. So I want to just talk a little bit about the chain of infection and how an infection spreads. So from an awareness perspective, an infection is a microorganism that's multiplying and infecting the body. And training workers in effective health hygiene etiquette will help to stop the spread of infection. And so in this chain of infection, what happens is you have an infectious agent, for example, a virus like COVID-19, and there's a reservoir, which is either a human or an animal, and there's a portal of exit. So an individual may cough or sneeze or have an open cut, and there's a means of transmission. So for example, the droplet is inhaled or ingested. And then we have a portal of entry, which is either, it could be the eyes, the nose, or the mouth. And the host is anyone that is or is in the area to take that virus in, that infectious agent in. So what we want to do is we want to put some in consideration for workplace controls and best practices. We want to provide a means to stop that chain of transmission, or create some breaks in the chain of transmission. And these are the reason behind some of the public health measures that have been put in place. For example, physical distancing, spacing, ventilation, hand hygiene, and masking. And so integrating these help to prevent. And I'll just talk a little bit about masking, for example, face masks that we are wearing when we're out and about and in indoor spaces. First of all, talking about hand hygiene and masking, we always want to make sure, and I do have some hand sanitizer available. We want to make sure that when we're putting our masks on, we are hand sanitizing well before we place our mask on. And I have a question for, or posing a question of those participating today. If you can identify what you might consider to be the area that is perhaps the most soiled on a mask, a face mask, if you're considering applying and removing it in areas not to touch. Any thoughts on that? Perhaps you can field your questions or put them in the chat.
Debbie, I don't want to cheat because I know the answer from our rehearsal.
Thank you, Scott. Yes. Any thoughts for those participating today? What might be the dirtiest part of your mask when you're considering putting it on and off in areas not to touch?
Oh, Janine, I think.
So I'm thinking that it's probably somewhere in the front of it, because that's where sort of the main contact is.
Excellent. Thank you, Janine, for your comment. And indeed, so I have hand sanitizer, and I just want to talk about that. So I brought a disposable face mask. So when I've hand sanitized before I put my mask on, and when I apply it, I want to make sure that it's covering my nose, mouth, and chin well, and I'm going to give it a good pinch. But in hand sanitizing, I want to make sure that I don't touch this area, because that is the area where we are filtering whatever we're breathing in and out, and we want to make sure we keep our hands out of that area. And again, when you're removing your mask, make sure that you've hand sanitized well before you remove your mask, and make sure you're not touching in those areas where you may have where it may be potentially soiled. Excellent. So thank you, Janine, for participating in that exercise. And so the next time you're out and about, have a look and see if you identify any areas where we've just talked about the touching of those masks, and just remember to keep yourself safe and not touch that area. And so just reiterating back to the controls and best practices of workplaces, we want to make sure that you have both a comprehensive safety and pandemic plan. And that really also identifies being prepared for outbreaks. So what kinds of things do you have to be integrating into your pandemic plan to be prepared for that? At Shaping Minds, we talk a lot about our health hygiene toolkit. One of the areas was masking. That is not the only area that we talk about in that health hygiene toolkit. So very good to have good training around that. Good self-assessment of your worker and visitors coming into your workplace. And definitely an ambassador program, because that creates a training in a network, creates a network and an engaged workforce right within your workplace that can help to promote these workplace controls and best practices. And we also want to highlight the importance of cleaning and disinfection. And the importance of this as well, because as we move forward, workplaces will be identifying what the best means will be for them to bring workers into the workplace and maintain that depending upon the model that's chosen for the workplace. And the specific workplace. So if we have, sharing of workspaces, we want good cleaning and disinfection of all surroundings in that work area and work environment, and establishing good routines there. So thank you for the opportunity to share this slide, and thank you for your participation. So then I just want to reiterate some of the benefits of an infection prevention program in your workplace. A clinically approved and evidence-based practice and procedures that maintain safety in the workplace help to reduce the risk of spread of disease. And that's really the key thing, is we want to be preventative. We want to help to reduce that risk. Meeting the standards of training and IPAC measures, employee hiring and retention. Some of the things that I've been talking to organizations lately about is the change in employees, the turnover of employees, and helping to retain employees. And I think one of the things that's very important for employees to consider, and maybe in the selection process of where they would like to work, is that they feel reassured that their workplace and their employer is taking a proactive approach to the hiring and the retaining, keeping their workplace safe. So something to be cognizant of and share with employees, that you do have that approach, and that should be a reassurance. Risk management, Doug referred a lot to some of the standards, and we want to really work in that risk management process to make sure that we are in the preventative mode of preventing illness and spread of disease, and the liabilities that Doug addressed associated with that. So you want to make sure that you have an integrated program that helps to manage that. And the cost impact. Of course, having a business shut down due to COVID-19 or any of the infectious diseases that may be out there definitely has a cost impact on a business. And if you have employees that are off ill, you're going to need to have employees replacing that individual in their position and their responsibilities, which can have an impact on your business, certainly. So that can help if you employ the right measures. That helps to minimize that cost impact that you may be experiencing. And the time and delivery methodology, I think taking the time to invest in a good quality program, and a program that can be delivered in a variety of ways, virtually is very important, because perhaps not all of your, again, when we're working in different types of integration in workplaces, various types of employees coming back at various times, and models of bringing back the workplace. We want to have a means by which we can deliver training and deliver a program effectively, whether that be virtually or in person. And we want to make sure that we deliver it in the appropriate amount of speed, and that it is so timely and the quality is there in terms of the training. And I think that leads me to my next point, that really a one-size-fits-all is not compliant. Really important to have a tailored solution for your business that you can, that you're working, the provider that you're working with understands your needs and can structure their training and can address some of the areas that maybe you're wondering about or have questions about in a manner that is going to be tailored to the needs of your business. And a quality training provider with a certification program and IPAC measures, really important from a risk management perspective. And so this is an opportunity now for Doug and I to answer any questions. We will bring it into an open forum, and we did post some questions at the beginning. There were 4 of them. So perhaps you have some, those that are participating have some questions around the training or around the presentation, and we would be more than happy to have you share those questions now. Thank you.
Great, thanks, Debbie. Thanks, Doug. And just a reminder for everyone, if you do have questions, you can either put them into the chat or just raise your Zoom hand, and we'll get to you as soon as we can. Debbie, this is probably a question for both Debbie and Doug. You know, as businesses come back from, you know, still a lot of people being home-based, you know, there's going to be a change in the work environment for a lot of companies. There may be shared workspaces, hoteling, things like that that are going to be happening. And Debbie, you just did talk about these cleaning protocols, but maybe you can elaborate on what companies really need to do to make sure that those shared desks and workspaces are safe.
Thank you. Yes, Scott. So I think establishing good cleaning and disinfection standards, looking at the high touch point areas that workers may be exposed to, that they're regularly, frequently sanitizing those areas. And I think as well, workers, it's important to employees coming into the workplace, a good risk assessment from themselves that they're coming to work well and entering the workplace well, and that you know, practicing good health hygiene etiquette, hand sanitizing, masking when necessary throughout in the workplace, in indoor spaces, and proactive approaches, and lots of education on those areas, and keeping the environment clean and tidy and organized in your workspace is really important. And certainly speaking to a health and safety representative, if there are concerns in the workplace, I think it's very important that they're addressed promptly and discussed, and proactively looking at measures to mitigate any difficulties that an employee would have. Doug, is there anything that you would add to that?
Yeah, I think I would just elaborate on the health and safety representative or the Joint Health and Safety Committee. It is one of the most valuable resources a business can have. There are certain requirements in regards to whether you need to have a representative if you have less than 20 employees, or if you are required to have a committee where you have 20 or more employees. The committee is there to be able to inspect the workplace and make recommendations on how to improve health and safety. So as a worker or even as a supervisor, they are a great resource that you can use to ask questions where they can actually go and get an answer for you. So I think I like, just to kind of elaborate really on your answer there, I would just say that, yeah, that it's a great resource for that a business can use to help figure some of these things out. And really, it all goes back to the internal responsibility system and making sure that everybody in the workplace is working together to help maintain health and safety. So they want the workplaces to figure out the health and safety issues before the government gets involved. So
maybe we'll come back to the government piece there too, but it strikes me that we talk about having a plan and educating people so they're aware of the health and safety aspects. But we know, as people walk down the street or we see them in different places, they don't always wear their masks properly, let alone knowing all the protocols that have to happen in the office on a day-to-day basis. So Doug and Debbie, how do we make sure on a regular basis that we're reminding people of all the practices that they have to implement?
I think really, like, if you train someone, it's one thing to sit there and train them, but you can't really just leave it at that. I think you really need to make sure that you have consistent communication, and it doesn't always have to be having them read a piece of paper that says that they need to do this. It's reinforcing it through inspections, reinforcing it through regular conversations, using people in the workplace who could be deemed as safety champions, or people who are like can have a positive impact on other employees. Having them remind people, making sure your employees know they can speak up, and actually practicing what you preach too. So if an employer wants an employee, whether it's a supervisor or a worker, to follow a requirement that the employer has put into place, the employer needs to follow the requirement that's put into place. A lot of the time, there could be many situations where an employer may say, oh, you need to do this, and they try to use the do as I say, not as I do approach, where the employer is the one that really has the ultimate authority, and they are looked at as the leader. So if they're going to ask someone to do something, they need to do it themselves. So if the employer is walking around with no mask on and asking the employees to put masks on, it's just, you're not going to ultimately have a leg to stand on with that, right? So making sure that you practice what you preach is one of the important things from a supervisor or even an employer's standpoint.
Debbie, did you want to add to that?
Thank you, Scott. I think excellent points, Doug. And I think what I would add from a training perspective is making sure that the reinforcement of that training, and that's hands-on practical exercises to make sure that when you're training, you see that the workers are understanding and demonstrating their comprehension of the skills and the competency, and having a network within your organization that can help to reinforce those practices is really important. And I think that's where good training and retraining to refresh on an ongoing basis is really a good recommendation for any organization. And having competent individuals provide that training is really also very integral in making sure that the comprehension is there.
At the beginning of the presentation, we looked at those 4 questions that we wanted to have people keep in mind. One of them was the notion of if a customer walks into the business and catches an illness that then causes them to take time off work, what's the liability if that is traced back to the company?
I think you're looking at a liability more along the lines of potential civil liability. What can happen really, and it's funny, many years ago, we'd have always had some sort of virus, or we've always had illnesses that have been there, and it has caused some people to get significantly sick, whether it's the flu, whether it's a common cold, even common colds or pneumonia or things like that. But now I think with technology, because of the fact that these things can be pinpointed literally to the exact location where someone could have potentially caught this illness, and if it does cause significant harm to that person, whether it's for their health or even financially, the employer could be held and the business could be held liable in this instance, where you're basically taking away someone's livelihood. And if you haven't done what you need to do, in order to be able to protect not only your workers, but also your customers as they come into your business, then you could face potential fines, or you could face potential civil suits in regards to this. And I mean, a lot of this really is preventative, and it may seem like a lot, but you need to take preventative measures to prevent anything like this from even potentially happening.
And Doug, you were just saying that we've always had illness like colds and flus, and then of course years ago we went through the SARS crisis. But I think what makes this a little bit different is this is worldwide, and it's affected everyone. And it's not just stories that we're hearing; it's a real life situation for everyone. So, Debbie and Doug, do you think that that this has kind of really shifted a lot of the mindsets of employers and employees in terms of what we have to do in the long term, and this is going to be more mainstream and then in our day-to-day for forever?
Debbie, do you want to answer that?
I think employers are taking and should be taking proactive steps to look at preventative measures within their organization. And I think definitely the long term need to be considering all elements of a pandemic plan, and having a regular review of that, and if necessary, having consultations to be able to see if what they've brought together is a good standard for their organization. So I think it is important, and as I mentioned, a health and safety plan and a pandemic plan are two separate entities. They work very closely together, but we need to think about the future. We need to think about the here and now. We need to take consideration for the future and what our how our businesses are going to stay protected and be proactive in the long term, as well as short term. Doug, do you have anything to add to that?
Yeah, I think really one of the things with health and safety is a lot of things have been reactive. So nobody really expected COVID to happen. Nobody really expected that COVID would last this long. And I don't think a lot of people expect that COVID is here to stay. In some sort of capacity, it will be here for the foreseeable future. I don't think there's going to be an end game in the sense of, well, it's going to be eradicated. I think it's just going to become part of the day-to-day life. And I think one of the lessons that we've learned from COVID is making sure that we have protocols and procedures in place to help prevent the spread of any sort of illness. Right now we have concentrated on COVID, but this can be pushed towards other illnesses and even the potential unknown, having a procedure. So what happens if something like this is announced, or what happens if a worker is sick and they find that it is because of this? What are the measures that the employer can take to help protect the rest of their workers, or to help mitigate potential losses to the business? I think that's where we're kind of heading with this, is that it's going to be something that it's going to be brought to the forefront a lot more, and it's going to be here to stay. So I think it's important to make sure that, you, as an employer, you have to make sure that you identify any potential hazard in the workplace to your workers and develop control measures. And I think part of this includes having measures in place for infection control, and making sure that pandemic preparedness and, being prepared instead of reacting to everything. Reaction, unfortunately, we didn't know about this, but reaction really has gotten us to where basically we've been over the last 20 months or so. And, we are going to learn lessons from this to prevent this from happening again, but we need to start to try to get ahead of it and try to make sure that we've already prepared for this so that we can mitigate any potential concerns down the line.
I think those are all important points because, I referred to SARS earlier, and I think, there's a big push after SARS for people to have pandemic preparedness plans, and people wrote them and put them on a shelf and then never looked at them again. until COVID came along, and then suddenly they had to dust it off. So I think that's a strong reminder for people that that this is something that needs to be not just documented and put away, but something that needs to be revisited and reinforced.
Mhm.
The Spanish flu happened in the early 1900s, and it was 100 years, or at least they say it's 100 years before another significant pandemic hit. But in the last 20 years, there have been concerns that have happened, not necessarily here, but throughout the world. We had Ebola a few years ago in Africa as well, right? So there's things that can happen. Like we need to be more prepared and putting these measures into place. So
I was going to add as well that I think it's we recognize as well that our federal, our provincial, and our local public health units have been very supportive and communicating all of the elements of what the plans are. And I think it's important to follow and understand all of those areas of the plans that are provided. And certainly public health is supporting all elements of those health and safety elements in our areas, in our communities. And so being safe ourselves creates a safe community. And then broader than that, as you mentioned, Scott, it is a worldwide pandemic. So it's not just here, it's throughout. And so recognizing that those organizations and those areas are working very hard to also be proactive and in all elements of this and in the future as well, thinking to the future.
And this week, the provincial government sent a reminder through the chamber, and we sent it out to our chamber members that inspections will be happening, especially as we get into the holiday season. And we know that people are out and about more with shopping or parties, things like that. So it just makes me think, Doug, there's always sort of the inspections on the health and safety side, but between Doug and Debbie, what's going to happen on the infection prevention side? Are there going to be inspections? What can the governments do in terms of enforcements or fines?
I do see the inspections also including infection control, especially with right now. I mean, they will be concentrating on COVID. So they want to make sure that when they're going out, they want to make sure workplaces have safety plans in place. They want to make sure that there's measures for physical distancing, measures for masks being worn indoors, measures for sanitizer and cleaning and things like this. And they will be going out with this, but I think it's just going to be added into the long term. It will always be something that they'll always be asking about too. And, a business can be fined or a business can be issued orders for non-compliance if they are not doing what is stated by public health. So if public health has advised because of a pandemic that you need to do this, the Ministry of Labor is using this and using the due diligence clause to issue not orders for non-compliance, stop work orders, and even can issue fines to business owners as well as workers in the workplace if they are not in compliance, if they're found in not compliance. Some of those fines, I know the minimums right now, I believe, are $750 for some of the COVID violations, and these can go up into thousands upon thousands of dollars for businesses who decide that they don't want to comply. And I hate to see people get hit with things like that for stuff that is completely preventable. And I think that businesses really need to make sure we are in colder weather, and we're heading into the holiday season. It'll get busier. There'll be more people. Capacity restrictions have been lifted in many cases, and does make it more likely that something could happen. And you need to make sure as a business owner you are on top of it.
So we talk about the liability side, and one of the questions that we had posted earlier talked about what happens if one of your employees, in spite of all of the protocols and measures that a business might have in place, what happens if somebody does become extremely ill? What is the liability then for the company, not just in terms of the time that the employee will be off, but any other things that may happen?
Well, the business will have WSIB involved in
Yes.
regards to the worker because it is a worker. The worker will have to go through WSIB for any benefits and stuff. It could affect the employer's rating because of this. The ministry will also probably be involved, Ministry of Labor, to determine whether the employer has been following the guidelines. And my honest recommendation to any employer is just, if the guidelines are there and the requirements are there, just do your best to follow them as best as you can. If you find people that are not compliant, you do need to address them and you need to discipline them as needed based on any disciplinary procedure that you may have for your workplace. Showing those measures, you're doing everything you possibly can. If you do that, then you're less likely to face any sort of potential fines or charges if you do have an employee who becomes sick and, even heaven forbid, becomes permanently disabled or even unfortunately passes away. So,
Debbie, anything to add to that? Or
I think it's the proactive approach. Once again, that we really want to, screening. There is opportunity for many organizations and workplaces. Preventative measures that are currently there's programs that are available. Proactive prevention from vaccination, integrating that into the workplace. Screening for COVID for employees as well. So all of these things need to be reviewed and looked at from a workplace policy and procedure perspective. And I think that is a proactive way to approach or the organization and the workplace. And I think it's very important for all organizations to consider. And
Debbie,
a good self-assessment for their employees. Sorry.
I was just going to say it's a good reminder to all the businesses that the rapid test kits are available through the chamber for free, courtesy of the federal provincial government. So for any employers that don't know that, there is on the chamber's website, there's a site for Chamber Safe, and on there you can book a time slot to come and get your free test kits. And I can tell you right now, we've given away almost 50,000 of those test kits. About 500 companies, separate companies. Some companies have come multiple times to get kits. And I think now we've protected about 10,000 employees and their families. So it's a great program, and I encourage everyone to take advantage of that. As we wind down in our program, just wondering, Doug and Debbie, if there are any things that we've missed or any closing comments you might have.
Debbie, why don't you go first?
I appreciate the opportunity to share the information and be really create awareness of the importance of health and safety and prevention, and the proactive approach that a workplace can take to help their workforce, and to engage their workforce in all of these measures that will help the future for organizations. And I appreciate the chamber enabling the opportunity that we've had today to share in this live at lunch presentation, and Doug for collaborating together with me to share this great information. I'd be happy to take a question if there is any from the participants. And Doug, thanks again. And Scott, thank you for availing the opportunity for us to participate today. Certainly a great forum.
And I think from my end, I think the important thing to remember is the chamber does a great job of sharing information to all the members. And as a chamber member myself, I am always happy to have a conversation with anybody about any questions that they may have. It's important to know that you have resources available to you, not only within your business, but also outside the business as well. And with that, I mean, any questions that may arise, whether it's now or even at any point, I'd be more than happy to have a conversation with someone and help them out. You can reach out to me directly, or you can reach out through the chamber, who will get a hold of me as well. So,
And we've got both your contact information up on the screen as well.
mhm.
Yes, thank you.
So Debbie and Doug, I want to thank you on behalf of the chamber itself and everyone that's watching this program. You know, Doug, you just talked about having resources, and I think it's, you know, it's very fortunate that we have people like the two of you as local business people and chamber members to help share your expertise and to make yourself available to local businesses. And obviously you're both in business too. So anyone that needs consulting services, you're both available to local companies to help out as well. So with that, we're going to draw our lunch and learn to a close. And again, thank you for those that have joined us live, and thank you to those that have joined us via your TV in Cogeco. And with that, again, thanks to Debbie and Doug for all of your help, and we'll see you next time.
Thank you so
very
much.
much, everyone. Stay safe. Happy holidays.
Yes, stay well. Happy holidays. Bye for now.